Check, check. All right. All right, y'all. We're about to get started. It's about 9:04. We try to give it a couple of minutes to let people kind of flow in. That's my phone. I'm sorry, y'all. Just checking time. All right. Just give it a few more seconds for those people grabbing breakfast to come on and grab a seat before we get started. All right, folks. So, listen, I want to welcome you all to our first annual summit. I'm not actually doing the welcome. I don't know what that is. Let me take this off. I'm not actually doing the welcome. I'm actually just passing it on to our Deputy Secretary of LDH. But just wanted to give you all just a little insight into how we ended up with this summit. As you all know, like over the last 6 or 7 years, we kind of went to each region and had these little road shows, right? About an hour, 2 hours, where we just dumped information at you all and then said, see you later. Well, we took feedback and we took surveys from everyone. And what was apparently clear was that while the information they received was valuable, they wanted something in terms of a little diversity, more sharing on specific topics, for a lengthier amount of time. So we said, okay, let's just do one region. Let's develop a summit. Let's have hot topics or specific dedicated tracks where we discuss specific things that are important to the community, and we'll knock it out in one day instead of a month across 10 regions. So that's how we ended up with this. This is the first one. If I have to say, if I'm hoping this won't be the last, but I'm really excited about this day, and I feel like you guys will gain some valuable information from these different discussion topics. Last thing before I turn it over to Pete, I want to give a shout out because this will be my only opportunity today to give a shout out to the OCDD staff. You see them walking around the building like they were instrumental in getting us set up for this today. They came in early. They worked over the weekend to get those beautiful bags together. So I really want to give them a shout out and a special shout out to Jamie, who's kind of spearheading all of this. You see her running around with the clipboard. So thank you so much to OCDD staff. Thank you, Jamie, for taking lead on this. I appreciate it. And without further ado, I'll turn it over to the Deputy Secretary of LDH, Dr. Pete Krogan.
Good morning, good morning. All right, let's see if I can do this without with the feedback. Y'all can hear me okay? Well, thanks everyone for being here at this first summit, especially those that stayed up late to watch a pretty epic college football national championship last night. I don't know if anyone wants some money on that game. I saw a few smiles this morning. This is, as Bernard mentioned, our first summit, and I think it is just so meaningful to see people from all over the state, every corner, self-advocates, families, caregivers, providers, lawmakers, community partners, and of course LDH staff. Because these systems really only work when the people who live in them help shape them. And that's what today is all about. So this summit is the official kickoff of our year together. It's a chance to reflect on where we've been, celebrate what we've accomplished, and clearly outline where we're going in 2026. I would say most importantly today is about listening, learning, and strengthening the partnership between OCDD, LDH, and the communities we serve. So I'll loosely follow that structure, reflect on where we've been in 2025, share some lessons learned about that experience, and then finally focus on where we're going in 2026. I would say the central through line of where we were and where we're going is that a belief at LDH and OCDD that people are more than their disability, that every individual deserves a life that reflects their interests, strengths, and aspirations. That we call a person-centered approach, very familiar to the folks in the room. The way I think that looks like in practice is not asking what services are available, but what kind of life does this person want to live? And I want to ground that with a brief example. We heard about a child who was referred to early steps at 14 months because she wasn't speaking yet. And her parents were very worried overwhelmed, unsure of what comes next. For all the parents in the room, I'm sure you can relate to that. And Early Steps doesn't just assess the child, it meets the family where they are, in their home and in their daily routines. Now, that child a few years later is using technology to help her communicate. Her parents use digital tools to help coordinate her care. She's more independent. And this is not because we, as the state or OCDD, did more to her. It's because we built a system that listened and adapted over time. I think that's what person-centered care looks like, and it can work across the lifespan. So let's talk about where we went in 2025. It was a tough year for a lot of the people in the room, a lot of uncertainty, families navigating complex systems, providers stretched thin as always, staff balancing urgency with compassionate care. I think it was also a year that required us to look honestly at how our systems were working and where they weren't in some situations. What I learned, and I think staff learned, was that good intentions aren't necessarily enough. To really execute on person-centered values, it only matters when this shows up in daily practice, and that involves safety and accountability. So that's why oversight became a theme of 2025, and one that we're going to continue into next year. Quality and safety are not just talking points and abstract concepts. These are lived experiences. And over the last year, OCDD really did a great job of strengthening oversight. So in calendar year 2025, 260 providers were monitored, which is a pretty significant expansion of our programmatic oversight efforts. And our compliance rate was 51%. I think that number matters because it shows us where support is needed, where expectations can be clearer, and where we can do better for the people that rely on us. Oversight is really not a punishment. It's a tool for better outcomes, stronger services, and safer, more meaningful lives ultimately for the people that we serve. So that's the first priority for 2026. Our three big initiatives are improve oversight, strengthen systems, and increase independence without losing sight of that individual. So our target provider compliance for 2026 is 75%. That, I think, reflects our commitment to accountability, quality, and continuous improvement. Let's talk about strengthening systems in 2026, and I'll start with Early Steps, which is our second major focus. For those that are not familiar, Early Steps is our early intervention program for infants and toddlers, birth to 2, who have developmental delays or medical conditions that can impact development. And it supports both children and families, builds their capacity to promote development in natural, everyday settings where children live, play, and grow, so meeting families and patients where they are. Early Steps is foundational, and in 2026, we're launching 3 big initiatives within Early Step. Streamlining the intake and service coordination process, which we know has been challenging to navigate. Introducing stronger fiscal monitoring, and ensuring multidisciplinary evaluations so children and families receive the right services at the right time. I think those 3 collective components will strengthen the system while keeping families and children at the focus of what we do. Our third and final goal for 2026 is all about increasing independence, and technology plays a pretty critical role here. I remember I came in with this administration in January of 24, and we had 3 primary goals from the transition team. It was improve health outcomes, it was patience over bureaucracy, and it was to help Louisiana citizens move from dependence to independence. And I'll never forget my first meeting with Julie Foster Hagen and her team, and she said, that is exactly what we do. Dependence to independence is the essence of providing services to people with disabilities. And I got chills at the time. I think I knew that abstractly, but I didn't feel it until I learned the day-to-day work of the programs that we design. And Using technology, I think, is going to be a key part of that. We know that technology can reduce reliance on personal care workers. It can increase community involvement. It can be very simple. It's someone using an assistive communication technology, managing part of their day, or using technology to stay more connected with their community. So in 2026, I hope you'll look out for a lot of initiatives along those lines, using technology, in some ways bringing us just into 2015 to be able to allow people to live more meaningful lives. So those are kind of the three big priorities: strengthening systems, oversight, and using technology to promote dependence to independence. I'm really excited for the sessions today. I hope you've seen the lineup. They align with those three priorities. The five big ones: one called My Own World, which is about supporting people to build lives that are meaningful to them. Building a meaningful day, because purpose doesn't stop at services. Technology supports, as I mentioned. Wellness as a protective strategy, which is about supporting the whole person, not just systems. And I'm more than my disability, which I think is a reminder of the dignity, identity, and possibility. None of this work happens in isolation. We need the voices and feedback and partnership from everyone in this room. I will take this moment to do three quick thank yous. One to the OCDD staff for all the work that went into this event. One to a very well-known person in this room, Julie Foster Hagen, who has put many years and hours and sweat into serving folks in this community, and has now moved on to be the executive director of the Rural Health Transformation Fund. So, if you have ideas for how that should be spent, she's fielding about 3,000 phone calls a day on how to use that money. And finally, a big thank you to Bernard for stepping up to serve as interim assistant secretary of OCDD. This is, y'all may see it, the role for the glitz and the glam and all the perks of being OCD assistant secretary, but this really is a tough job that takes incredible dedication and passion and a thick skin, because everyone is so passionate about serving the people that we all care about. And sometimes I think that can lead to more conflict than agreement. And it takes, as Julie did, a very important guiding light to bring us all together and remind ourselves that we're on the same team. We all have the same interests in mind. It's to help Louisianians move from dependence to independence. That's what gets everyone up and out of bed in the morning. And so I'm looking forward to seeing that conversation continue today. Thank you for being here. Thank you for being on this journey with us, and let's get started.
Such a long walk from the back. I'm sorry about that, y'all. So just to give y'all kind of an update of what's next, we'll be moving to our self-advocacy panel. So it'll take a couple of minutes to kind of get everybody set up, and we'll kind of just keep moving from one topic to the other. So, folks, Jamie, Felicia, Kevin, let's start getting set up in the front so we can get started. Check, 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 check. All right, there we go. Can y'all hear me? Oh, there we go. Perfect. All right, so you'll see testimony at the legislature. You'll hear from all kind of folks all the time in the DD community. But I feel very seldom do you hear from folks, self-advocates, individuals with disabilities often. So we wanted to take an opportunity to kind of bring some folks up, have a quick chat with them so you can hear their perspectives, some of the challenges they're facing, as well as some of the aspirations and goals they have. So from my left to the right, I'll kind of introduce our panel. First is Jamie Duplashan. Next is Felicia Woolings. Did I say that right? Woolings?
Woolens.
Woolings, there it is, Woolings. That was crazy, I got the Duplashan right, but not the Woolens, right? And then last is Kevin George. All right, so we'll just jump right in. We'll kind of do this round robin. I'll give the question to all of y'all, and each person kind of respond, and I'll start with you first, Kevin. So I touched on aspirations and dreams, right? So, Kevin, where do you see yourself in 5 to 10 years?
15 years still working with y'all because we a tight family, so we got to stick together. I just love my job because it's hard out here for people who trying to get a job. You got to put your foot into the fit in. That's the only way you can make a difference in your life, make sure our children is more safe, have more positive in their life and God in their heart.
All right. Felicia, same question to you. Where do you see yourself in 5 to 10 years?
So in 5 years, I hope to be immersed in advocacy. I think we still have a ways to go when it comes to expanding education opportunities, employment opportunities, healthcare opportunities for people with disabilities. I serve on the board of United Spinal, which is a national organization that advocates for wheelchair users, and I plan to stay the course right here in Louisiana. I also hope to live independently. I currently live at home with my parents. That's why I'm so passionate about expanding state services for people who work with disabilities. I hope to also travel more. I want to visit so many different countries and different places. I want to visit Svalbard and different countries in Africa, Switzerland. I plan to go to Switzerland next year with my family, so hoping for that. And finally, I just hope to really just go further in my career. I'm in the legal profession, so I am currently just trying to build upon that, and I want to venture into real estate. So those are my big goals for the next 5 years.
Look at Felicia being humble. So not only is she in the legal profession, just my fellow bar member, she's actually a licensed attorney. So.
Why did you say that? Now
I do
I
the
can't
same.
be nervous.
People make me. I do the same thing, Felicia. I very seldom tell people I'm a licensed attorney, so I understand. So I had to mess with you. Sorry. So Jamie,
Okay.
same question to you. So where do you see yourself in 5 to 10 years?
Well, so a little backstory with me. I was injured at 15.
I don't think I'm mic's on. Sorry, Jamie.
Because I talk loud anyway. People hear my voice when it really needs to be heard, trust. So I was injured in a car accident when I was 15, and so I guess I have a unique perspective where I recognized how an individual was seen differently after disability. When I was 13, I met a cousin who was a wheelchair user all her life, and it just so happened that I asked her what it was like being in a wheelchair, and she said she couldn't tell me because it was all she knew. And then 2 years later, I ended up having a car accident and becoming paralyzed. And so then she was able to ask me what it was. Luckily, the state of Louisiana has great programs, and I was able to live on my own. So I've been living independently since I was basically 17. I am at a point in my life where I've been really active in the advocacy world, but I want to shift where my careers are concerned and still advocate. That's why I'm here today. But so I just see myself doing something different in the next 5 to 10 years and continuing on my advocacy journey.
All right, so full disclosure, Jamie, Felicia, and Kevin, they're members of our LDH Self Advocacy Group. So we meet quarterly, I believe, and kind of discuss several of these topics. So these questions kind of stem from those discussions. One of the discussions they've had, and if I had to give it a theme, it was being boxed into a system, right? Not everyone that's in that self advocacy group receives services or supported by the traditional system. There are other systems at play as well, but the general sentiment centered around boxed in or alluding to limitations related to the system, right? The system. So I'll start with Jamie this time. So for those who receive supports, there's a balance between what you want to do and what you can do. Can you give us a little insight into what that means for you?
For me, I don't always see a balance in what I want to do and what I'm able to do, because when supports come into my home, they don't always have the same beliefs as me, or I've had people have trouble recognize me as an individual and just see my disability and don't feel like I should be doing some of the things I want to do. I just want to live. I may want to go to a club or a bar or have fun. I'm a fun person. I'm silly and I enjoy getting out and doing things. And so if someone comes in and they have a belief, maybe a religious belief, and they're not able to go to a bar or club or something, then that limits me, and I'm not able to do that when I want to. Also, a lot of times, some people won't drive out of town, and I like to travel. I like to do things out of town, and so that kind of just limits me as to what I'm able to do as opposed to what I want to do.
All right, thanks, Jamie. Felicia, same question to you. Do you feel there should be a balance, or there a balance existing between the wants and the cans in terms of what you want to do versus what you actually can or?
Yeah, so I think this thought lingers in the mind of many folks who receive supports. Um, I look at it as far as, we are having to consider, can we work this particular job? Can we work these many hours? Can we pursue this particular dream? I often think about a close friend of mine. Her name is Kara. She has osteogenesis imperfecta, and she's a very fun person like Jamie. She lives independently. She has full-time staff, but she can't, she's afraid of working a full-time job, and she's really afraid of pursuing her dream in theater because she doesn't want to lose her supports. So of course there's a blessing in it in receiving supports, but she has to sort of have this trade-off where she can't, pursue the career that she wants to pursue. So I just think that we have to think about these sort of things when, we're pursuing our aspirations. So I just want members in our community to, go after what we want to go after, and, not feel so constrained and boxed in by, what's out there for us. So I think there is an imbalance, but it's just what comes with the territory of receiving supports.
Comes with the territory.
Yeah.
That's unsettling. All right. So Kevin, same question to you, man. You want me to repeat it for you? Is there a balance between what you want to do and what you can do? Or should there be a balance, and does that balance exist? So same thing.
Yes, it do balance. It do balance that same thing. For me, I'm trying to work on it to. I live on my own, so I'm trying to get me a vehicle down the road. Not right now.
All right.
So for me, it's not hard. I like to ride the bus from back to forth, but to me, it don't matter to me because I got God in my heart. I ain't worried about nothing. Because I'm always going to support me and everybody else in here. I ain't worried about nothing, but as long as I got God in my heart, I'm going to be just fine.
So Kevin, wait, keep that mic. Got a question for you. So can you give a little insight, give a little more detail into your relationship with your direct support worker?
A support worker is good because I love the person who I be with because as long as I get respect, they get respect back. You got to treat me equal, I treat you equal. We got to be on the same page as each other. We can't go against another one and against each other. You can't have that conflict because you're going to mess up your relationship with that person.
Thank you. So keep the mic. I'm coming to you again. All right, so listen, while you're saying that, there's the next question kind of dovetails into what you were just saying. So you guys mentioned in those advocacy groups that sometimes you feel like your life is on the whim of someone else, right? So you touched on it a little bit. So what does that mean for you? And can you give an example of where, you felt like you were pushed in a direction and may have been urged to take a direction based on someone else?
I don't look at it. I don't look at that as trying to push on, but I'm just gonna keep pushing, keep forward, keep my mind on myself. I don't need nobody to tell me what I can do, but you got to believe in yourself. Can't nobody tell you what you can't do, you can't but you got to figure that out for yourself.
So you don't have a problem advocating when you're like, that's not what I'm trying to do.
Nope.
Nope. I know you don't. That's why I started with you. So Felicia, same question to you. Like, do you have an example of where you can say like something or your life was kind of in the hands of someone else or based on whims or some views of other folks?
Yeah, definitely. So my life sort of depends on other people to step in. The pieces must be in place. A great example and one I deal with frequently is people showing up on time. So if people don't show up on time in the morning to get me up, oftentimes I have to sort of make adjustments in my schedule. So that's been a big one for me when I'm welcoming people into my life to provide services in the home. And there have been times where I've had to, maybe skip breakfast or just sort of skip something in my routine in order to make it to wherever I need to make it to. But nonetheless, I will say I'm very grateful for the people in my life. My mom and my sister are here with me, and I am thankful to God that I have a team in place. But I think that is one big area where I can honestly say that, I'm at the whim and the mercy of, other people sort of stepping into place and filling in those gaps for me.
Thanks for that. Just never think how simple it is, just someone being there to help you get up, right?
Yeah.
It's just simple things.
Yeah.
Jamie, same question to you.
I basically feel the same way because, well, luckily I have 24-hour care. But if someone doesn't show up or calls in at the last minute, I've chosen to do self-direction. And so it's all on me, and I've got to find someone to come in my home and support me. I'm very grateful for the caregivers that I have in my life. I've got a good group right now, and they're always willing to help when someone doesn't show up or they're not able to come because they're sick. Or, I mean, I've had girls have to come in with migraines and sick, but we make it work.
Thank you, ma'am. So listen, this is the last question. I'm gonna start with you, Jamie, but just this touches on the theme of this section, whereas I'm more than my disability. So, Jamie, one thing you want to take away, the folks on live streaming, the folks here in the room, one thing you want them to take away from this discussion and apply either in everyday life, law, or even policy making. What's that one thing for you?
Just to recognize us as individuals.
There you go.
Just to continue to recognize us as individuals, not our disabilities, because our disabilities are simply a piece of who we are. Disability is natural, and we're just humans, and we're just trying to live.
All right. Kevin, what's that one thing you want folks in the room and online to take away?
One thing to take away from this room,
Put that mic to you.
they take all the knowledge we gave y'all for today and think about what you're going to do. If you don't understand it, just write it down and then remember what we always saying about being who we are. We don't judge nobody who they are in wheelchair. You got to respect that person who they are. You can't judge nobody color who they are in the wheelchair. We got to be there and support these people who really need disability in their life, because God don't like that. We got to be there to support the people who really need their help.
Thank you, sir. Felicia, can you wrap this one up for us?
I would say just invite us to the table more often than not. And one other thing is to just think about what makes you feel quote unquote normal, happy, and fulfilled. A lot of times we want the same things without feeling so restricted.
Got you. So listen, we breezed through those. I think we practiced too much. So I got a couple of off-the-cuff questions, if y'all don't mind. And I don't know if how in depth we'll get. Hold on one second. All right, sorry about that, y'all. We got self-advocates in the room, and I guess this is energizing them to kind of jump in. But look, just real quick. So, it's a two-part question, and I'll start with you, Felicia. Overall, in Louisiana, do you feel like we have a responsive system, like to the needs and supports needs of the individuals in the state? Do you feel like that system is responsive?
I believe it is responsive, although I think we need to build on it and think about ways to be more inclusive, especially for people who do work or who have certain injuries or disabilities. So I just would like to see more expansion in those areas over time. And again, I just want folks with disabilities to be invited at the tables a bit more when we're developing these policy and these laws. I think our voices should be the primary input. So I think it is responsive, but I think it could be a bit more considerate of our opinions and input.
You stole my follow-up question because I was going to ask you, do you feel like it's respectful overall? Okay. Jamie, I'm going to ask you a different question. So I know you on several advocacy fronts, right? You're always in the mix. Like, how do we as a state specifically, this is a selfish question, sorry, y'all, how do we solicit feedback from more self-advocates? I feel like we don't have a direct line to them like we need to. Do you have any tips, tools, recommendations you can make to us to kind of reach out to more of our self-advocates in the community?
I've been pondering on that for years, Bernard. We need to get people active, but I think honestly, doing things like this, Bernard, and making it obvious that we're open to hearing our self advocates in the state will bring them more out and open to get involved. A lot of times they don't want to get involved because they feel like, why? Nobody's listening anyway. But if you're opening the floor and making it open for us to be for our voices to be heard, it'll bring more people and self advocates out.
All right, where are we? All right. So I think that's all we have, y'all. I know we kind of breezed through that a little bit, but I do appreciate y'all for coming up here and agreeing to speak with us. I'm not going back to Kevin because he's wearing an Alabama quarter zip sweater. I want to point that out to everybody. So please haze him on when you see him throughout the day. I asked him not to wear that sweater, and he did it anyway. And he's poking fun at all of the LSU fans in the room. I just want y'all to know that it was definitely intentional. So please give him a hard time because he gives us a hard time on a daily basis. Every year when LSU plays Alabama, he comes to work with scarves and hoodies and jackets and book sacks. So please take your time to give him a tough time. So again, they cut me off, so there it is. So again, thank y'all for joining us. We would have opened it up for Q&A, but just the layout of the room, it just doesn't work well. But again, I thank y'all for your time, and y'all will be hanging around throughout the rest of the day. So if anyone wants to kind of talk to them offline, I'm sure they'll be more than welcome to having discussions after this panel is over. So thank y'all. Thank you again. Can you patch me in? All right, so listen, y'all. Okay. We're a little ahead of schedule, so we'll take a 10 to 15-minute bio break. Please go out. I think there's some light refreshments out in the front, so we'll be back with the legislative panel once we can get that set up.
Ladies and gentlemen, if you could find your seats, we're about to start a nice little Q&A and a fireside chat. So if we can all make our way back to our seats, grab another cup of coffee. We will begin in 5 minutes. 5 minutes.
All right, folks. All right, so listen, we're going off agenda. All right, check, 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 check. So since we have extra time, we kind of gonna go off script a little bit and have a discussion and maybe open up for some Q&A. Up here with me, we have Dr. Pete Krogan, Deputy Secretary LDH, Julie Foster Hagan, the Executive Director of the Rural Health Transformation Office, and we'll just leave it at nope, and former Assistant Secretary at OCDD. And while we were over there talking, I thought might be a good idea to kind of just give some insight into what to kind of expect in the legislative session, as well as this is Dr. Pete's idea. Open it up for Q&A. So if you got folks outside and they got burning questions, please tell them come in now because we only have a little bit of time, and we got some folks that'll work the room with mics to answer any questions you guys may have. So with that being said, I guess I'll punt it to Pete and have him give a little insight into what, from a legislative perspective and an advocacy perspective, right? what are some tips, tools, tricks, trades, insight that you can give that may be helpful for the folks in the room and online?
Yeah, I thought no better way to welcome Bernard as interim assistant secretary than like an AMA, one of those Reddit ask me anythings. But well, in terms of legislative strategy, I'm taking tips from the folks in this room. Right, there's not more, less. This is the most active, effective group of advocates I think we've got at the legislature. So I think we're even more effective when we're working together, state hand in hand with advocates and provider groups. So let's kind of cover as much of that as we can over the next 30 minutes or so. I will throw out one kind of idea that I'd love to get some, if you're not ready to react to it in the room, it can kind of percolate over the next few hours. But we've been kicking around a idea for a name change for the office, almost a rebrand, and not just for the sake of logos and everything. I know it comes with a lot of work, so the juice has to be worth the squeeze, but it would give us an opportunity to really send a message on what it is that the office does. I mean, to my comments earlier, it's not just about people being defined by their disability. So how do you kind of put that patient-centered focus in the name in the office? And a lot of other states have done something like this, so I thought I'd just throw that out there for kind of reactions. And in terms of what it would be, that we'd host the process and get input from everyone in this room and folks online, and there have to be some degree of consensus. But that's just one thing we've been kicking around in terms of coming into the session.
Yeah. So what you'll see in the next month or so, we'll be posting polls and where you can vote on potential naming options. We're also working with various stakeholder groups to get recommendations from those people as well. So more to come on that, but like Dr. P said, this is exciting and this is an opportunity for everyone to share in the naming of this office that means so much to so many people.
Yeah, I think it's just part of a broader goal. I'd really like to see this office and this set of services that we provide be re-energized and be the focus, one of the pillars of this administration, that dependence to independence theme that I mentioned earlier. I think this event is a huge first step. I think something very public, I think would be a nice compliment in terms of a rebrand. And then but it's not just words, right? The substance and the programs are gonna have to meet folks where they're at. That self-advocacy panel was fantastic for me to hear. We got a lot of improvement to do. Yeah.
All right, we got questions already. Go ahead.
Okay, I've been brainstorming this for 42 years. There needs to be a governmental office in every parish, and those people are already there, or there's a person here from every parish in the state. Because we are from Gonzales, I'm not driving to Baton Rouge to get information. And I have in the past. I get nervous, I'm sorry. Passionate. Recently, I have been the contact for a lot of parents in my parish, but every parish in the state needs an office. Not money, because the governmental offices are already there. We just need a place and a direction for our parents to go to. That's my advice. Thank you.
On? Can y'all hear me? Oh, wait.
Yep.
Okay. So I'm a mom of 2 special needs kids, 16 autism and 7 with Down syndrome. So I'm here as an advocate for them. My name is Samantha Reed. I have a question. So my question is, and I'm not sure who to direct it to, are there plans to improve waiting lists? My question comes from a letter I received the other day from OCDD, and my youngest has been on the waiting list since he was a month old, and he's 7 years old now for a waiver system. So that was my question, is if you're working on the waiting list timeline.
So there is no waiting list in OCDD anymore. So I think I know what you're talking about. Was your son recently screened for urgency of need? A son, you might know it's a son screening.
2 years ago.
2 years ago. Okay. And you're looking to receive waiver services?
Yes, sir.
Okay. Well, what I would encourage you to do is get with your local governing entity. You're in Baton Rouge area?
Unfortunately, Livingston Parish.
Yeah. So does Livingston fall under
Region 9.
Region 3? That's Florida Parish's Human Service District. Region 9. Sorry. Thank you. Region 9. Get with Florida Parishes and request an updated screening because we issue waivers based on urgency and need. There's no wait list. So there's that, and there's also TEFRA as well. So if there's more Medicaid-specific services your son may need, not waiver services, because we often hear that. Families think that everything runs through the waiver, and that's not necessarily true. There are state plan services that if you meet the eligibility requirements through TEFRA, you'll be able to tap into those services once you're determined eligible. So just knowing stuff like that is important. So great question. Get with your LGE, which is Florida Parishes, and they'll be able to guide you in the right direction.
Thank you.
Yes, ma'am. All right. So what else we got next? Any other questions before we move to something else?
We're in lots of different support groups of parents, and one of the things that happens in Region 9, which is Florida Parishes, and I don't know if it goes across the state, is that the initial intake to get in to begin exploring receiving services is a telephone call to Florida Parishes. When that person calls you back, it doesn't say it's Florida Parishes. It might come back with state of Louisiana or unknown number. So this parent who left a message then receives sort of a random phone call at a random time, and if they miss it, then the whole process starts over again with them trying to leave a message and then trying to get someone to call them back. So we were talking about if there was a way to do some type of or online intake system so you could place your information in and then someone could contact you by email so that it's a little bit more secure instead of going through the old-time telephone call system.
All right. Thanks for the feedback. Thank you. I think that's something we can definitely look into.
Yeah, this is something we encounter throughout the department when we're trying to do contact tracing, for instance, for an infectious disease exposure. And we really need to get in touch with someone. But if it says possible spam, that's the fastest way to get deleted. So I think a great example of where we can maybe use low-hanging technology to better serve folks. Yeah, good call.
So, Julie, I'm going to put you on the spot. All right, so you've been doing this for a long quarter of a century or more. So,
and how can that be when I'm only 30 years old?
I know, man. I mean, Doogie Howser. So anyway, so can you share with the group now that you're out of the role and moving on to other things? Can you share your views on where you feel the system is going and what folks can do to continue us in the direction that you feel like we need to go? Gotcha.
Loaded question. One of the things I think in this current administration with the focus on, and Pete talked about it earlier, dependence to independence, that's something that I feel is just critical that we refocus on. As I think about, when I started 27 and a half years ago, I started working in a state-operated facility, worked as a speech pathologist there, ended up closing the facility or privatizing the facility. One of the things, folks were really concerned because back when we started having state-operated facilities, we didn't have waiver services, so there was nowhere else for folks to go, and that was a choice people had to make. Suddenly, and around the 90s, we started having waiver services, and the conversation shifted totally to a different conversation. We used to never talk about people with disabilities and employment, and that's just critical to me now. But we didn't talk about that much in the 90s either. And so, I mean, I think we see a constant continuum of things changing. I see us continuing to change. I think we all need to be open-minded about, and as Pete said, hearing stories from self-advocates is critical, because everybody has a different story, everybody has a different need, and we need to think about how we deliver services not in one little siloed way, but thinking about how we set it up so that whether you are a 17-year-old who can't use words to communicate, or someone who's been in a car wreck and has totally different needs, that we have a system that's responsive. And I think we've been trying to do that. It maybe doesn't always come across that way, but the folks we have that work in OCDD are all passionate about figuring out how do we make it easier. With government, there's always going to be barriers because there's certain rules and regulations that we can't get rid of, that we have to follow. But I do see us continuing on a path. And again, you may be sitting in this room like, well, you're not making it easy on me right now. But we are always trying to think about how our system can be as flexible as possible, and how do we make it as responsive to all the different needs. And I do see with the team we have at OCDD, I see us continuing to do that. And what I hear more, the reason why I go back to dependence to independence, is because when I looked at the trajectory of where things were when I started to where they are now, like, that's what people want. That's what folks with disabilities want. That's what parents want, is for their kids to be able to have some of that independence. And so I do see us continuing to do that. I see our office continuing to hear from you guys so that we can think about ways that we can continue on that path. And I think we'll all continue to struggle together to figure out the best way to make that happen. Although I'll be doing it in the rural health world instead of the developmental disability world now.
Yep, and I agree with that. Hello. Yep, and for those who had the pleasure of, they don't want me to, okay. For those who've had the pleasure of working with me in the last 10 years, one of the biggest things that I'm always on is what's next, right? How can we continue to improve this system, I told my folks around Christmas time, I had a terrible reference, but I'm going to give it to you all. If they would have stopped at the first iPhone, right, when that came out, that was groundbreaking. They could have dropped the mic and said, okay, this is as good as it's going to get. But we're 17 iPhones in later, and that innovation and that focus on keep pushing the meter with the same outcomes, right? Easy, efficient communication, right? That focus, though, they didn't stop at what they thought was perfection at the time. And I think we know, for a lack of a better term, when we push to eliminate that wait list and give services and have waivers available to folks, I think for some folks, they thought, okay, this is the promised land. It's good the way it is everywhere else. But in actuality, that was just a starting point. If you look at other states around the nation, they're just getting to their waiting list. They took the last 10 years to really revamp their services and push it into the future, having services that are dynamic in the sense of meeting needs of people who may not need your traditional in-home supports, right? So they went that way and backed into addressing their wait list, when we went the other way because we understood the need. No way is wrong, but the point I'm making is there's work still to be done. And, we may not be all on the same page in terms of how we address that, but we will definitely, like we've always done, be open to having those discussions with you all and landing in a space that works for everyone, right? With the focus of moving us to that innovation, to that next phase of the iPhone, for lack of a better term. Got questions?
Thank you. And I want to thank you all for this. I think this is great. And I look forward to more interconnected meetings where we have a number of folks from different areas. So I want to thank you for that. I have two questions. One is, how did you get the feedback, information to develop those priorities, those 3 priorities? How did you get that feedback and from whom? And my second question is, how are the changes in Washington, D.C. affecting our supports and services, or how do you anticipate those affecting our supports and services moving forward?
Yeah. So the priorities, I would say, is a constant process. There wasn't a start, and there definitely won't be a finish. I see a good set of priorities as entirely iterative. So we come with some ideas, we get feedback. We could do a meeting like this, and y'all say 2 of those 3 sounded great. One of those, if someone threw something at me, I'd be like, okay, noted. We're probably gonna scratch that one from the priority list. It involves what's politically possible, matched up with what makes good policy sense. And sometimes I think of it like there's 50 political possibilities and 50 good policy ideas, and maybe only 3 of those are overlapping. And I see our role to really identify those 3 with the input from the folks in this room and focus, right? Because that's the hardest part, is working through all the competing demands. There's so many things that we need to improve to make the experience of being a Louisiana citizen the standard that we all hold in this room. And so to be able to dial in on what we think is going to be the highest yield, that's where we came with those 3. But it's not done. I'll say that we welcome input through that process.
Yep, there we go. And Pete, it'll be fair to say with public policy, a lot of the stuff we do encounter is reactionary, right? It stems from something that prompts it to be addressed. The 3, if I could give like hierarchy themes, how we landed at that 3, a lot of national trends and some federal influence, specifically with early steps. That one was more federally driven, or need to address some of that. The other ones were just following national trends and practices, mainly around that increased quality and monitoring piece, as well as the tech transformation. So those are things that's moving on the national front, and that's a lot of that expectation. And we've been clear in through other things like our value-based payment model. You see a lot of that trend like there infused in some of the incentives that we have out around the technology grant, around some of the compliance-based things that we have in there, retention and things like that. All of that is all stemming from some of the same sources, but there's not one particular, to Pete's point, one particular thing that said, oh, we're going to do these 3 things, and this is, no. So it's a combination of things, right?
I would probably tweak one. I agree with everything you said except one word, and that's the follow part. Because I think part of it is reactionary, and part of it is us leading the conversation. Some of our ARPA initiatives, for instance, I think were really touted nationally as pretty innovative around technology. So that's it's nice to be recognized on the national scene, out of Louisiana. Maybe I'm just biased, but it feels good to be acknowledged when we push the envelope. And I think it just gives us more fuel to know that, we can be innovating nationally. Which brings me to your second question about the HR 1, the big, beautiful bill. The short version, I think, is not much for the patients, for the people that we serve. Sorry, I use patients as a doctor more than I should, so forgive me on that. But the people we serve in Louisiana, as you know, there's in statute specific exceptions around work requirements. I think community engagement requirements. We're still crafting those, but a disability is certainly in statute and an exception for those work requirements. We do have the advantage of the author of the bill. The staff member on House Energy and Commerce is now our Medicaid director, Seth Gold. So we have he got the envious task of implementing his own bill that he wrote and seeing it from the other side. But to that point, we have no greater expertise probably than any state in the country in terms of how to actually implement it. And his passion is 1915C waivers. So for all us nerdy policy people pushing up our glasses, this is the exciting flexibility that's coming out of HR 1. He's more modest than will be, but he pushed to put that flexibility in the actual bill. So when we have issues and there's no-brainers, and y'all say we just need to change how we design this program and this waiver, or how we cover people, or how we do eligibility. And then poor Julie and Bernard have to say, we'd love to, but federal statute says we can't for these 3 reasons. Now we have a chance to take another look at some of those barriers with these waivers. So that's the part I'm most excited about.
And yeah, by 1915C, he means the waivers and all the waivers, like on the agent side and the DD side. So that's your Nile Row, Children's Choice. Because there's folks on the phone like 1915C. What are you? Pardon us. I've been slapped on the hand by several folks for the acronym soup. But yes. So what he's referring to is our Medicaid director has crafted a lot of those flexibilities to allow the expansion of more waiver types. So, nope. So, go ahead. Yeah, go ahead.
Well, I think the big thing there is that it's not going to come for a couple of years, but what the big change was, you're all familiar with 90Ls probably, or level of care determinations. And what this new authority does is allows us to think about a pathway to get home and community-based waivers without people having to meet those, quote, institutional levels of care, whether that be nursing facility or intermediate care facility levels of care. And so it kind of broadens what we can do. Now, we still have to be fiscally responsible in that, because you're, opening the door to more people and thinking about what it looks like. But it is, we do have some children or adults with autism who don't meet eligibility for OCDD because they don't meet that institutional level of care, but they still have a developmental disability and may have needs. And so it'll allow us to think about maybe we have a different type of waiver or different service package for those folks. Similarly on the aging side, but I can't remember the year. I think we have 2 or 3 years out, and so through the National Association of State DD Directors and Advancing States, which are the 2 national organizations that do that, I know there's a lot of talk around making sure that we're thinking through what that might look like for states and what those are, but it's around the institutional level of care for home and community-based 1915C waivers.
No question? This is the last question, because after this, I'm going to have to go wrangle some legislators for for the legislative panel next. What you got, Bridget?
Is that me? Okay. Hi, my name's Bridget Wilson. I'm with the Arc of Acadiana. Peter, when you were speaking just now about technology, it prompted a thought, and since y'all are here, it's a little in the weeds, but something that providers a big change recently was that we have to check the exclusion reports every month now instead of every 6 months. And so if we do the math, 535 providers every month checking to see if 5 or 10 people were added is a huge time burden, an administrative burden on our network. And so I just wonder if you're thinking about modernizing our technology, that one of those things could be that we get told when somebody gets added instead of us having to check. And then same with critical incidents. I was on a critical incident call and they said, go check every day just in case. Oh my goodness, again, 535 people every day, times 2 or 3, it's a lot, it's a heavy lift. And so if we could think about modernizing some of those administrative tasks, that would be really beneficial for providers. And a second follow-up, different, is about our aging population. I was told recently we have 11,000 people on our elderly waiting list, with more people coming available every day. And so I just wonder what the state's thoughts are on trying to keep those people out of nursing homes and in their homes and aging in place. Thank you.
Great. Two great questions. The first one, short version is, I love the idea. I think that we have to find that balance between oversight and just an absolute burden on a provider to the point that you're hiring additional staff just to meet a requirement. There's definitely a happy medium, and I can tell you that this team loves to find that happy medium. So I think we've got a new director of the Office of Economic Independence, Camille Conway, who's really an eligibility expert, and I think is going to be a great resource in having these discussions. That's one of Bruce's vision for 26 is pulling eligibility staff. It really was prompted by us taking over SNAP and 1,300 employees actually the day before the government shut down, which was our welcome to LDH moment. But thinking about how do we streamline eligibility decisions across the department, because ultimately there's a ton of overlap in services. And to the first question about the local level, it all comes back together at the local level. It's a person and their family and where they work or go to school and their community. And so how do we disentangle all the threads from Baton Rouge and when it comes back together at the local level and make that easier on people? I love the CCW, so the Community Choices waivers. This is our OAS waiver. Really, we're swimming in y'all's wake in terms of OAS. So the great work in terms of waitlist elimination for the DD waivers has proven to our OAS folks that it's possible. You know, not that it's easy, and it takes a lot of work, and no one can speak more to that than Julie. But there's a way to prioritize based on need, not on just a wait list and who gets in line first. So this was, we were meeting on this Friday at 5:30 p.m. before a long weekend, which staff didn't love, but that just shows you how high a priority it is. It's going to take, you know, it's a little more, it's a different waiver, it's a different population, so there's going to be a slightly different solution, but I think the approach is the same. How do you risk stratify and get some folks services now to keep them in the community before you know, you're forcing someone to go into these longer term institutional stays? I think we're going to try to get ahead of the 1915C flexibility, but that, of course, coming down the road, I think would make things a lot easier if someone doesn't meet that institutional level of care, and we can get an early, because right now the wait list, if they are receiving services, I think is 14 years till they're on the CCW waiver, which a lot of people don't have 14 years to wait. So we need to get service to them sooner.
All right, y'all. So thank you so much. We gotta wrap. We gotta wrap. We could talk to you afterwards, but
what was your title, Peter?
Deputy Secretary of LDH.
LDH. Okay, number one, LDH needs to be broken up into many different departments, because think about it, people in the audience. LDH is responsible for people with disabilities, all the nursing homes in the state, all the caregivers in the state, all the foster children in the state, all the hospitals in the state. That LDH, that's why people are dying. Because you, one department, cannot take care of all the people in the state.
Well, I do appreciate acknowledging how
and I want to say one other thing in a passionate way. I'm not trying to speak loud or be defensive, but Louisiana is on the bottom of the list. I disagree with you. Louisiana is on the bottom of the list. I have visited many other states. There are people 25, 30 years ago that had speech therapy and physical therapy, and these individuals were going around in their communities. Louisiana, I'm pretty sure, was the last state to close 9 institutions. They have 2 left in the state that I know of that work with individuals with disabilities, and they're up north. Louisiana is the last state, and we, as a collective community, need to speak to Governor Jeff Landry.
Well, I can thank you for your passion. I'll say that this team wakes up with the same impatience that you're experiencing. I know it's personal because it's you and your family and people. I don't mean to add any separation. I can just say that there are not a lot of perks for the folks that come to work, you know, to my side, and they do it because they care about the exact same thing. And they are so frustrated that we spend so much on healthcare and we get such a bad result. And that's true, you know, we're also over chronic disease and many other, not child welfare yet, fortunately, you know, that's another big challenge. But I would say the department is growing in a way because sort of the other direction of what you're suggesting. And I think that's a recognition of what we can do at scale when we're actually more coordinated and working together. And so we're not making eligibility decisions in a different agency across town that reports to a different secretary. Too much of the services that we do, because it is large, come back together at that local level. So I think there's some merit to actually consolidating and trying to be more efficient and provide better services to our patients. But I thank you for your passion, honestly, because that's what fuels us too. So thank you for your comments.
Yeah, thanks. All right, Pete, we getting the hard stop, so we got to get ready for the next panel. Thank y'all. So we'll be back in a few minutes once we get the legislative folks up here.
Thank you.
All right, all right, all right, all right, all right, everyone, folks online. This is the last session before we end the live stream. And before I do, I want to give a shout out to our ASL interpreters. Thank you all for hanging in with us. It's about to be a lot of talking, so I hope you guys are ready. I'm excited about this. We have Senator Regina Barrow and Senator Rick Edmonds here to take part in this section. We had a couple of other legislators that unfortunately had to pull out, but we're great with the folks we have. Senator Barrow, she's president pro temp, so while she doesn't tie to a specific committee now, she has the luxury of jumping in on all, but as you all know, she has a history with the Health and Welfare Committee. She's familiar with our waivers. She's familiar with what's going on, and she'll add valuable insight. Same with Senator Edmonds. He was on Health and Welfare, both on the House and Senate side, right? And is currently on Senate Finance. So this is the money man. So we're excited to jump into this. How we'll do it, Felicia and I are kind of ping pong questions. We have about 4 or 5 questions that we'll bounce back and forward to you all, and then we'll give you an opportunity to kind of share what you're looking for and what you have going on the horizon in the next session. Sounds good? Sure. All right, so I'll kick us off. So the hardest question of the day. So as you all know, the topic of the workforce, the direct support workforce, has been a big thing for several sessions, right? So please share your thoughts on the state of the workforce and provide any insight or any additional kind of thoughts that you have on how we can address that.
Great.
I'll start with you, Senator Edmonds.
I'd be glad to. Well, good morning, everybody. I'm so honored to be here today. Great to meet friends as I walked in the door, and we'll chat more about that through the questions probably. But again, you're a great group of workers, and I'm honored to be able to serve alongside you and try to help us get to another point. Workforce development, I think, is doing across the board as good or better than it's ever done. I've been in 10 years. I'm starting year number 11, and I'm very happy about where we are with workforce development across the board. And I think that we are making some really giant steps in preparing the workforce in a variety of ways. One is we're trying to tie in what we're doing education. I chair the education committee as well in the Senate side, and we're trying to really work with those guys to make certain that we prepare a workforce that's not going to do all this effort and then there's not a job for them. We want to find that particular career and help them, whether it's a credentialing or whether it's all the way through, some type of graduate school, from the base all the way, no matter what it is. Great jobs that are coming. We've got a lot of economic development that's going on. Again, probably the good as it's been in decades. So we're going to need an expanded workforce. We know that. Now, as it relates to this community, I think, as I sit here and think about this, I think, why wouldn't we develop something with workforce that's specifically for the developmentally disabled and enhance that? Because there are a lot of jobs that are available. Now, not everybody. Look, you wouldn't want me to be a welder. I don't think I'd ever be any good at it. It's just not my skill at all. So I'm not saying everybody's designed for every job, nor would you. But I do think that what we can do, and I think we would have an open door with workforce, and I think with Kim Hunter-Reid, if you don't know Dr. Reid, who is leading our secondary education, phenomenal woman that has great insight, and I'm working with her now. I think we could probably, maybe even this session, start enhancing, if you guys have an interest, of what we can do to get that lane developed more. And I think I don't know that we're doing that, and we've done something, but I don't think we're doing what we could. And I think that might be something that you guys could really help us in your thoughts of, we have to survey the whole state. We have to determine what kind of workforce we need in volume, and then in this case, where our developmental community would fall into, multitudes of these jobs across the state. And I think there's some learning we'd have to do, and you have to have a little patience with us. But I would be open to some suggestions, and if it's even legislatively, and I know we'll talk a little bit more about legislation at the end, but I certainly am open to that.
So Senator Barrow, before you jump in, let me just kind of give you a little follow-up. So specific, you've heard direct support providers mention that they're competing with Walmarts and Apple and some of the other vendors for workers. Can you kind of jump in and give your thoughts on how they navigate those fields of recruiting staff to this particular workforce that serve people with DD?
Thank you so much for the question. So before I answer, I would like to give some information about you. So by a show of hands, if you are a provider, please raise your hand. Wow. Okay. If you're here as just a layperson who is coming to the conference to get more information, raise your hand. Okay. And if you are here representing one of the major companies that are outside that has a tent or a table set up, raise your hand. Okay. So I want to see who I was talking to first, because I kind of thought that's what the question may have hinted to initially. And so this is an issue that we have been trying to really grapple with. And to some degree, we made some attempt to ensure that we added the extra $2, I think it was a couple years ago, for individuals who are working. But that is, it's not keeping up. It's not keeping up with the cost of living. And that's one of the things I have really been actually taking a look at, because it's beginning to affect me, really, be quite honest with you, as I'm looking at now a widow, right, going from 2 incomes to 1. That's making a huge difference. And so everything is going up, and being able to find individuals who are able and really to do a good job is becoming harder to do, especially when you can go to Walmart or you can go to even McDonald's, right? And some of them are starting off at 12, 15. I want to say one of those places actually started at $15 an hour with incentive pay. And so it is becoming harder to do. And so one of the things that I think we need to take a look at is how we can begin to, how the state may be able to, and this is something I know is going to make some of my colleagues cringe, but we have to be, to me, I think we have to be innovative, and we need to think outside the box, because we're not going to be able to keep up at this rate. We're not going to be able to keep up at this rate without being able to maybe invest in a little bit more. And so one of the things that my colleague just alluded to was ensuring that the individuals who actually have a disability, making sure that they have access into this arena. And that may be something that can be maybe some kind of agreement that as we are helping individuals, until we are able to better subsidize this need, creating some kind of fund, right, where we are actually assisting individuals who may currently be unemployed but want to work, right, want to contribute, have value to add even though they may have a disability, and being able to come into that arena, because I think that's something we have not done. And I think that may be a huge asset to them and the state. But as it comes down to addressing the real core issue, because I'm going to go back to it, I don't believe in not answering the hard questions. We're going to have to come up with something different. The $2 was something that we came up with it. We are still, I think, still doing, right? But that's not enough. And it's hard to, and I'm going to tell you why I know, because I am personally going through this myself in my own family. So I know. So to answer the question directly, I don't have a direct answer other than to say that while we have done the $2 is not sufficient enough, because it's not keeping up with the cost of living, and we have to think outside of the box. And I'm open to thinking outside the box in terms of how we can bring those potential workforce individuals into this arena, in addition to maybe looking at how the state can additionally subsidize its arena until we are doing a better job in a better space.
Thank you. And just a follow up. So when you say think outside the box, you mean in terms of like not throwing additional funds at throwing funds at the service? Or are you talking about like outside of the box in terms of professional development, like Senator Edmonds said, or maybe some other options as it relates to the direct support workforce, right?
A combination of both.
Combination of both.
Because I think that we need to actually add more, right?
Yeah.
We do. We actually need to add more because it's not keeping up with the cost of living for individuals to come into this field. Then the other part of that is actually adding the professionalism, professional training for those individuals so that they can be added to the workforce.
Cool. Thank you. Anything else? You good? You good? Good. Felicia, you got it.
Thank you, Senator. So, as you know, working and being able to retain state care is a big topic in this community. So, there are many individuals with developmental disabilities who either are not made aware of gainful employment opportunities or reluctant to seek desired gainful employment due to fear of losing needed supports and benefits. Please share your thoughts and any advice to individuals faced with this delicate balance. Senator Barrow, we'll start with you.
So, as I stated before, I am literally living this with my family, right? My dad was diagnosed with dementia about probably, let me see, about 5 years ago. And this has been such a journey for me, especially as an elected official, because my family think that certainly I could answer all the questions and check off all the boxes and make sure that everything is in place. And so we've had to walk through this, and we have been through at least 5 workers. My mom has been extremely frustrated because of the high turnover, things not working out the way that she thought that it would, or, in all honesty, not really dealing with the issue and not accepting it. So that I'm just throwing that in. That has nothing to do with the question, but I just thought that I would add that because I think it's important that sometimes there are some other underlying issues that may be happening in families. And so to address the matter, one of the things that I decided to do since I'm living it is actually having a conversation starting first with my family in terms of expectations, what's realistic, and what we should expect. And that has not really gone over well. Let me just, my sister who has gone to medical school, who should, to me, understand this issue a lot more than anybody else, has been one of the persons saying stuff that, and I said to her this morning, because my dad is in the hospital now, I said to her, you know that it's not true. Do not say that. Because she was like, oh, he can remember, blah, blah, blah. No, you know that it's not true. Then she's like, oh, well, I'm tired, blah, blah, blah. So I think, and that has nothing to do necessarily with individuals. So let me go back to the question. Repeat that question one more time.
There are many individuals with developmental disabilities who either are not made aware of gainful employment opportunities or reluctant to seek desired gainful employment due to fear of losing needed supports and benefits.
Okay. Mm-hmm. So going back to that question, that starts with the awareness of what the department actually makes available. And and this is one thing I don't know, because I have not had the opportunity to take a look at the website to see what information is actually displayed. I would say to individuals not to be fearful of going into this area of the unknown. And I know that that's a huge issue because, my mom, we kind of gone back and forth with the income, right? Because you don't want to lose income. There's a delicate balance in terms of, what assistance you can receive, what you can get, all of those things. And so being able to just kind of launch out into the deep is what I would call it. I would say not to be fearful of that, but get all your information. Make sure that you have a good safety net of individuals you can call. I think that's real important. So having somebody in the department you can call. Having your legislator you can call. How many of you know who your senator is by a show of hands? Oh, hey, I'm glad. Okay. How many of you know who your representative is? Okay. So I would encourage all of those who do not for you to actually go to the state website, www.legis.la.gov, and find out who your legislators are. Reach out to them before session begins. I would highly recommend that you reach out to them within the next week or two, and introduce yourself and share with them what things are important to you, because you never know. Some of those things are important to us as well. We are living real life just as you are. And we are experiencing oftentimes, the same thing that you're going through. And so your idea or your challenge or whatever it may be could be something that sparks something for us to actually lead into other legislative ideas. But I would say create your own safety net, and don't be afraid to launch out. Don't be afraid to ask the questions. Don't be afraid to talk to the department. Don't be afraid to share ideas that you may have that you see, because we don't see and know everything. And may be something that you have that may be an idea that can spark something that may not actually even cost the state a lot of money to put in place.
One thing, Senator Barrow. So, quite literally, what is, in your opinion, the best way to reach out to your senator? Because I've done this in the past, and I typically get this sort of boilerplate response whenever I reach out. So what do you find is the best way to reach out to you or your peers?
So I would say the best way to reach out, and so did you email?
I did.
Okay, all right.
Most times.
I don't know about, because I'm going to be honest, I don't know about Senator Edmonds. I'm not really big on emails. I do respond. I do have pretty much like this cookie cutter type email that we send out so people know that we did see it and respond. I would say to call, to talk to the legislative assistant who's oftentimes in the office and share with them, hey, I would like to have 10 minutes of Senator Barrow's time to talk about whatever the issue is. That would work best for me. But each senator is different. There are some senators who prefer an email, and then they will respond right back telling you blah, blah, blah. But when you ask, be real specific about the ask. Say, I want to meet with you to talk about X, Y, Z. Or I have this concern about X, Y, Z. And I'm going to tell you, 90% of us will respond.
Thank you, Senator Edmonds.
You ready?
Yes.
You want me to go back to the original
Yes.
question to start with? Okay, good. So I still am going back to what I think is, and I don't know how I'm going to suggest. It seems to me that there needs to be a collaborative effort to start if we're not doing, and obviously because you're asking a question, it's certainly got to mean that there's a miss here, we're misfiring. So how are we going to line this up? So whether or not workforce needs a complete separate division for disabled, which I know a lot don't want to be tagged necessarily, but you can just help me get it right here. But I'm thinking here, I'm spitballing, as they say. We have to create pathways for people no matter where they are. Doesn't matter if it's a 25-year-old with no credentials that has nothing to do with the disability community. We have to create a pathway for them. Monty Sullivan, who just left community technical schools, would tell us between the ages of 25 and 55 is our largest section of adults that have no credentials. Well, when they want to go get one of these great jobs we tell that's out there, or just a really good job or a better job, they can't get the job because they don't have any credentials. So one part of this for this community is there's got to be a connection point between workforce and probably the Department of Health. And in doing that, I think what would happen is you would see a whole assignment of jobs that are available, and then the training necessary for that job, and then what the result, even by the hour or by the salary or is available for that community. I don't think we're doing that. I think those specifics, I'm not just a data guy. I know data can be cold, but if we don't have data, it's hard to plug people into the right thing. We're doing this now with college students, just finishing and doing several pieces of legislation that, although it's a different subject, but just hang with me. If you go to college and get a degree, and after you get a degree, there's no jobs, but you got a degree, then what good was the degree? So now we're going to require, we're working on this to tell every college student to work with that department in every one of our universities. This is the job market. This is what's out there. Now, if you don't want that job and you don't, that's not what you want to do. You want a degree in art? Great, go get your degree in art. Just know that's 1% or 0.5% of all jobs available. I don't think we're doing some of this with the disability community. So I think we could probably create within the workforce the kind of jobs that are available, the kind of training is available, and how we plug the agencies together. But collaborative effort we do all the time. And I think we could figure this out to say, here's our community. Let's just say we had, I'll just use any number, we had 1 million in the developmentally disabled, and there's 600,000 jobs that fit these categories. You got where I'm going? I don't think these connected points are happening. So my suggestion would be, whether legislatively or through agencies, that we begin to search this and figure out how we can plug people in or prepare them. Training's necessary. A lot of our developmentally disabled don't have the training they need. Maybe we need a fund. You know, Regina, we created the Murphy J. Foster program a couple of years ago, and it's doing great. And it has nothing to do with this community necessarily, but it's doing really well. Now we're working on the incarcerated community, that they want to get a job. They want to get trained. We want them to go back in the community. We want that father, mother to be productive. So we're working on that to try to plug them in a pathway. Why don't we think the same way for the developmentally disabled community? And begin to think about what training is necessary. You mentioned a fund. Maybe there's an alternative fund that we put together. Maybe not a lot of money, but it's a start point. Again, I think all these are possibilities that might work. Now, I'm going to answer your second question and I do agree that I think we have a lot of really great people in the legislature. You may not read that in the paper if you're a paper reader. You know, we may not rate high on the latest poll. But honestly, I know every legislator, and she does too. We know every one of our colleagues. We don't all agree. We're not all from the same backgrounds. But really, I can't name somebody and go, oh, they're a horrible person. I can't name any of those people. Most of the people that we have are serving, making very little money, spending an enormous amount of hours, and they've got a lot of care in them. What is required of us is, it's a long answer, but this is your fault. You said I want to make sure you understand it. We are expected to be experts in every field in the state of Louisiana, all of them. Hospitals, developmentally disabled, minerals, education, now transportation. How do you expect us to do that? And the answer is, that's hard. I'm not whining. It's just, you may call you could call your legislator and say, hey, I need some help with a now waiver. And they're going to go, what's a now waiver? They have no idea what you're talking about. You may talk about a rate increase and say, a couple of years ago we had, and we fought for this and got it, our intermediate care facilities hadn't had a rate increase since 2008. So I went to other legislators. Regina's one of them. She was on board with this early on, so it was different because she was involved. But some of them, not being bad people or not caring, I said, we need this for our intermediate care facilities. And they went, what's an intermediate care facility? And they didn't do it because they're bad people. They just hadn't got there yet. They don't know. If I said, oh, how about, early steps? Most of y'all know something I'm touching one or the other here. I said now waivers, other things. Well, they didn't know. Hey, 11 years ago, I didn't know either. And I've had to learn. You helped me learn. So I'm still learning. So at least be a little tender with some of our colleagues because they just not going to know everything there is to know about oil and gas and everything there is to know about early childhood. It's that broad for a legislator. So help us learn. That's the first thing about being involved with your legislator. If you come to the Capitol, which some of you I heard in the earlier session, you don't want to come to Baton Rouge, I get it, but we're here. So we'll be here 100 days in a row plus. And I've never turned down meeting with anyone. I have a downtown office and I have a legislative office. You need to know this. Every one of your state senators and every one of your state representatives have a local office somewhere in your district that has a full-time employee in that office. Now, they may not respond the way you want to, and all of us handle it differently. Maybe they respond well to emails. If they don't, you need to find out how they do, and that's a little work on your part. But if you come to the Capitol and request to sit down, the odds of you getting to sit down, pretty high. I would say during session, exceptionally high because we're there every day. I would also say for constituent services like you and me, our administrative assistants, most of them are pretty good people. If you'll give them, I'm sorry you didn't get what you needed, necessarily. And I speak again. I wish we could all meet everybody's needs, but we have some good people. They want to help you. I want to help you. I have to learn, and it takes years of working with people like us. This is a good woman. She want to learn. We all want to learn. We want to do better. That's the big answer. It's long-winded, but you gave me a microphone. It's y'all's fault.
So here's the good part and the bad part, right? Y'all are so forward thinking, y'all already started addressing the last question. So just to stay on it, and then Felicia, I'll come back to that next question. But they get the meeting, they get you in the office, right? What tips, tricks do you have for them to get you guys to champion what they're talking about?
Yeah, I'm going to go back to that. I'm going to tell you, there's nothing like personal contact. I'm old school. You give me a meeting with somebody face-to-face, I'm old school. Now, my kids, they want this. That's all they want to talk about, right? And that and pads. If you want to come to my office and sit down with me, I love having meetings. I want to sit down. I want to see what you're talking about. I want to feel for where you are. I'm a person like that. That's the way I respond. It's hard for me to answer for all 144 legislators. I would say most of us, let me say this, many of us like that. During session, we do a lot of sit-downs, or we come out and we come out of our chambers and we meet and talk and make us notes. I'm going to go back to my prior conversation. Make it as simple as you can. Help me understand what a now waiver is. I know now, but I didn't know then. You're going to assume and you're going to miss. So come in with that's 4 points. I mean, simple, that any of your legislators can understand. This is what it is. This is what my need is. Will you help me fix this? And or suggest, here's what we have looked at. This might work. Most of them will welcome that. I've asked people, send me a list of 10 things, then send it to me. Tell me what the answer is, so I don't have to go figure it out. I want all the help I can get. I think most people would respond with that. I think in person for me is the best. Lists are good, and I can tell you I'm a finish, and I'll let my colleague here speak. We get a lot of this too, and I must say never, and I know that's a broad word, but we'll get some subject matter and we'll get the same 500 emails, identical 500 emails. Watch this, never works. When I see 500 of the same one, I may not even read them. When I see it from you and I get one on a subject that's legit, that's different. So that's for me. I just don't like 500 emails on the same subject that looks like I'm being manipulated. I don't like it. I'm not suggesting that you're not desperate, but I'm just being honest. I'm just telling you how I feel, and I'm not telling you I'm right. I'm just telling you how I feel. Okay.
And as you can see, we really have a lot of similarities. I am old school as well, so I believe in talking with people. I would love to meet with you. In addition to that, prior to session started, I have community meetings in the district. So any of you who are living in Baton Rouge and somebody say they are I'm their senator. I will be having a series of community meetings starting next month to hear those matters. And I'm going to tell you, many of the pieces of legislation that I have actually brought to the legislature have actually been thoughts and ideas from constituents. Yeah. So don't think that your idea is not a good idea, because you never know. Because what I do is I take that idea, I bring it to staff, And I say, so what does the current law say? How can we make this better? Is this something that you think is doable? How can we make it work? Then I'll go talk with somebody like my good friend Rick, right? Because oftentimes we may not be, so we have a lot of things that we actually agree on, but that may be something that he sees in this bill that, you know what, this may be a problem for some of our colleagues. And so you may want to look at doing this. And that's how you begin to really kind of collaborate. But it's really not as hard as it may seem. As he stated, as I said, many of the legislators there, they are good people, and they want to do what is right. They want to address the need, but sometimes they don't know what the need is. But I would tell you, more than likely, either they know someone or have someone in their family who's dealing with probably something very similar that you're dealing with. This is not a topic that to me, does not touch the legislative family at all. Many of us are dealing with members who have disabilities.
All right, so y'all took notes because I did. I took mental notes. So don't do canned emails. Call and schedule a meeting. Make sure you're concise, to the point, hit the high points, be clear on the ask, and if you have solutions, share those solutions, right?
If I may,
Can I jump on this too?
Yeah.
Because you just said something that's really important. Because I want, if you don't mind, before I forget it, because I forget it, because I'm old now, you know. So she said some of my best bills came from constituents, directly from the constituent. I did an adoption bill when I first got elected, came straight from a father in his house. And I took the bill and got it passed, and I do constituent bills. She just that was such a great point. Every year I bring some constituent bill. That's your bill. And I have to go tweak it some because I know it won't work that way. But there's not hardly ever a session, I don't think, in 10 years that I hadn't had a constituent bill. That was such a great point. I want to make sure that they understood how good that was.
Yes. Sorry. No problem. And this is the other thing that I would say. When you get to know your legislator, when there is something that comes up and they are unsure about it, because we cannot be an expert on every topic, and we say everything from water, gas and oil, food, health care, insurance, anything you can imagine, we see it. But they will call you, because I've done that. When there's an issue that's come up, where's Jackie Blaney? I know Jackie is here because she came and spoke to me. Jackie, where are you? Raise your hand. Yeah, okay. So Jackie Blaney is one individual that I know very well, and I have called her on matters that I'm unsure about. You know why? Because I was like, it looks like it's good. It sounds like it's good, but sometimes the devil is in the details. And so for individuals who are in that work, they know a lot better than I do, because it looks to me like it's a good bill. But when you get to know your legislator and they get to know you, they will be very comfortable in calling you on issues that they are unsure about.
Thank you, Senator. All right, let's shift gears a little bit. Ableism often rests on the assumption that disabled people need to be fixed in one form or the other. Ableism is intertwined in our culture due to many limiting beliefs about what disability does or does not mean, how able-bodied people learn to treat people with disabilities, and how we are often not included at the table for key decisions. What advice would you give to individuals with developmental disabilities to help overcome these challenges? Senator Barrow, we'll begin with you this time.
Doggone, she gets to go first again?
Sorry, Senator.
Go ahead, Senator.
Hey, you go ahead. Go ahead.
You already had the mic, T?
We're having fun. So yeah, I want to get in on this a little bit. First of all, everybody needs fixed. You know, so that's a kind of different viewpoint for me. Is like everybody's got flaws, so it's just the way life is. So I think that's just the way you should. And it doesn't mean bad. It just means everybody got flaws. And so I want to personalize this. I have 4 sons, and prayed for boys. God honored my prayers. But my second boy was born 9 pounds, 1 ounce. I named him after my wife's father. who was a strapping 5'10", 245-pound fullback, played at Louisiana Tech. Well, first few months of his life, his right leg didn't develop the way it should. And then the time we got to the next few months, it didn't develop the way it should. And the time we got about 13 months old, we got an x-ray, and they said, well, your son's leg is, that you have a particular congenital birth defect. And so we were floored. We had no idea, like many of the parents you deal with. We had no idea. And then came the rest of the story. And the rest of the story is that this pseudoarthrosis of the tibia is what's going to happen is your son's going to break his leg. It's going to happen. It's just a matter of time. We had no clue. I'm sitting there looking at the doctor just like I'm looking at you. And he said, your son's leg going to break, and it'll never heal again. You ready for that? Ain't no ready. 13 months old, guess what? Walking in the backyard with a long leg brace on his leg. Guess what? Broke his leg. His tibia broke right in the middle. That started with us surgery after surgery after. So I've laid on cold floors, hospitals, just like you have, for 8 straight years. And guess what? Physician was right. Prayed, begged God, did everything. Leg broke, doctor said, never healed. Never healed. So at 8 years old, I had to sign the papers, amputate his leg. God gives you favor, but man, probably the toughest thing I've ever done. So I relate. Now that's an emotional kind of story for you. It is. But I've lived in some of your shoes, not all of your shoes. Some of you providers, I've not lived in your category. But I have lived somewhere. And I recognized a long time ago that we were never going to treat my little boy like he was handicapped. Never. And to this day, we've never treated him like he was handicapped. When he got a prosthetic leg to run in the front yard, my boy's so competitive, if they were losing the football game, they'd tackle and pull his leg off to make sure they didn't get a touchdown. That's my family. That's my boys. So a bunch of deacons in my church told them how to do that, so that's how that happened. But I'll tell you this. We always treated people like they were normal. And I know that everybody's not normal, and what is normal? I get it. Please don't fuss at me because I'm just talking to you like a friend. That's it. I'm telling you, we have to treat the disability community like they're special, like they're favored, like they're awesome. Best church member I've ever had was in Shreveport, Louisiana. Was developmentally disabled and never had a better encourager in life. So I think the first thing we do, and the answer is we always stress to those around us that we teach people to treat people like they're normal. We never treat people like they're handicapped. We never look at them that way. We help them along the way because everybody needs fixing. That's just my word for it, and I know some of you don't like it, but that's the way I mean it. I mean it the right way. So what we do is then we enhance opportunities. We think with the parents. We help providers. We try to think in the shoes that you're in. We learn along the way. We invite legislation that helps fix these things. We never have enough money. I'm on finance. I've been on appropriations. This is my 10th year. We'll never have enough money. Bear with us. We're trying to get more to push in. And contact your legislators, pray over them, work with them, and try to get it to that point. So I will say in my closing part on this is that the developmentally disabled community is a community just like a lot of communities. It could be an addictive community. It can be an incarcerated community. It can be an impoverished community. It can be a single mom. They're all communities that have issues, an issue of some nature. And our job, all of us, not just legislators, all of us, is to try to figure these things out and serve one another the best that we can to engage with our community. I don't know how far off a track I am, but at least that's what I think. You know, the way we treat one another, whatever you want to be treated, you treat somebody that way and you'll be treated back.
In the mic drop. In the mic drop, everybody. Thank you for that answer, Senator Edmonds. So, Senator Barrow, you got it. No, you good. We got, just FYI, we got like 7 minutes. I'm not rushing you. I'm sure everybody's fine with a shorter lunch, but just giving it to you now, and then we'll have one more follow up.
Well, I'm gonna try to give this answer in 7 minutes or less. Certainly, I agree with my colleague, and I would say just to add a little bit of grace to those individuals who may not understand the quite shortcoming. Add a little grace to their shortcoming of not understanding, because unfortunately, media, things of that sort have made us think that we have to be a certain way. And then if you're not that certain way, then you're not perfect. Because at the end of the day, we absolutely all need fixing. We all have something, right? Everybody has something. I don't care who you are, what you are, how smart you are. And it's really funny, growing up, there was a lot of things about myself that I didn't like, right? Until I started meeting other people. And so I say give a little grace to those individuals, because society, things that, what we are introduced growing up, especially as young ladies, make us think that we have to be a certain way, right? And so you begin to educate folks. And I'm just going to share my story about my grandson when we went to school. When he first started going to school, and I never forget when he was in kindergarten, and the teacher called me and said he was standing up on the desk and running across and all this kind of stuff. And I'm like, he can't be doing that, because he doesn't do anything like that at home. We had never seen that. So certainly one day she said, well, I'll tell you what, why don't you come up here one day and not let him see you, and I'll let you see what we see. And certainly I did, looking through the window, and there he was running all across the window. Running across the desk as I'm looking through the window. And so I have not ever really been a proponent of medication. I was not a proponent of giving a lot of medication or medicine. And I really don't like taking medicine myself. Just my own that's my lip. That's one of my flaws. And so when the doctor proposed it, I didn't want to do that. Then by third grade, when he was not really performing well in school, they did an IEP on him. And I would never forget this. It was like yesterday. And she looked at me and she says, not only is he developmentally delayed, but he would be what they would consider to be retarded. And I sat there and I looked at her, and I didn't move. My face didn't change. And she said, did you hear what I said? I said, I heard every word that you said. I heard every word that you said. I say, however, I do not accept what you said. I said, so this is what I do believe. I believe that exposure, I believe that training, I believe that education can begin to put him into a different pathway. So while I understand what you said, I do not accept what you said. And I said, I'm going to use every resource that I have to make sure that he receives resources, that I expose him, I bring him places, I do things with him so that he can be a productive member of society. I want you to know that my grandson graduated from high school last year. He actually was doing dual courses. So he was graduated from high school at BRCC and graduated from BRCC in May. It was because of a summer program, and that goes back to resources that Mayor Broome actually provided, where we learned that he loved gardening and agriculture and farming and farm animals. And so when we learned that, I began to put him in that pathway. And so he loved horses. He told me the other day he wants to be a bull rider. And I'm like, a bull rider? I am absolutely not ready for that. We have this great event that's coming here in April. I forgot what it's called, Habaco or something with agriculture. So it's a big rodeo thing that travels across the country. It's coming here in April. He's already learned about it and told me he wants to participate. So I would say that as you encounter people who think that individuals that have a disability is limited, that you help to expand their mind to let them know that it's not. And just because people has been set with a quote unquote set label, it does not have to be that way.
Thank you.
All right, and look at that, 2 minutes to spare. So listen, again, y'all, thank you all for coming. I know you took time out of your busy schedules to be here. We really appreciate it, and I'm sure the folks in the audience appreciate it as well. See, folks, we are not an afterthought, y'all. So nah, but I appreciate y'all coming. So I'll give y'all these last few minutes to talk about anything you wanna take a question.
Any questions?
All right, hold on.
Okay.
Hold on. I'm coming.
Somebody else if they haven't spoken. Okay. No. Okay, no. Just real quick. And Bernard, I'm gonna back up from you because I'm about to talk about you. I need to give a little pushback on your comment about throwing money at. I'm thinking about my niece who at the age of 22 was in a severe car accident, and she's quadriplegic. Vocational rehab trained her. She works for IBM and data management. Okay. What I'm understanding now, though, is that Voc Rehab is really, really underfunded. You need not you, but a little money need to be thrown because that particular system, it really worked for her. And she's, okay, so that was one example. The other thing is that in terms of throwing money at, is that individual supports saves money. Because when people receive individual support, not that they're not flaws, but it supports folks with medication, keeps folks out of emergency rooms. So who you rather pay, the emergency room or me? Because you're gonna pay me a whole heck of a lot less. And people will be in their homes and getting the proper medication. So when we think about throwing more money at, I want you to think about how much money we save from emergency rooms to institutions that need to be not thrown at, but redirected.
Thank you. All right, so I'll give it to you all. I just got the hard stop in the back, unfortunately. So I guess we could do a show of hands, because I don't know if that question was directed to the legislators or not.
Was it?
It was more of a comment. So do y'all want to keep going and ask questions, or do y'all want to go get food? Oh, yeah, we do. I'm sorry, y'all. We do have to do a hard stop. We got to reset the room for the breakouts. I'm so sorry, y'all.
Okay.
Again, thank y'all for your time.
Okay. Thank you.
Thank you. It was so great meeting you all. Oh, my mic.
Sorry, there we go. Oh, he's looking for his? Yeah.
All right. So just a little bit of housekeeping, y'all. So everyone that's in the room, we need y'all to exit the room because they have to reset it. I think is lunch ready?
No.
No? Okay.
Lunch will be at noon, but we need to get
Yeah,
everyone
so we
out of
need
the room.
everybody out so we can reset the rooms. Thank y'all.